Hi everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well. And we've got another interesting case here. As you can see inside the ear canal, we have extremely dark, almost black oxidized wax, which is adhered to the bottom of the ear canal. So the background to this case is that this gentleman had a blocked ear about 6 months ago. He tried drops for a couple of weeks and then gave up and has only now just come to get it removed. So I don't know exactly what drops they were, but I imagine they were probably something like sodium bicarb, which went some way to dissolve the wax. But then when he stopped using it, it sort of solidified into this sort of black rock, essentially on the bottom of the ear canal, which is stuck there. So in terms of removing it, you see that I'm going in with a suction tube here, and I'm not trying to vacuum this out because, I mean, clearly by the look of it, it looks essentially like leather. So it was never going to come out with suction, but I'm just probing it to see if there's any movement, which there was. So what I'm now going to do is go in with a St Barts hook because there's a gap, as you can see, up at the top of the ear canal. So I'm going to go in behind the wax with the St Barts hook and just see if I can loosen it. So I'm not expecting to drag it all out with the hook, but what I'm doing is just being very mindful of the feeling that I'm getting in my wrist as I'm using the hook and watching closely to see exactly how much movement there is and whether I can safely peel it off the ear canal. So as you can see, there is a lot of movement there. The whole piece is actually moving in the ear canal and it's loosening up, which is a good sign. And you can see just as I'm dragging these pieces forward, just how dense and thick this piece of wax is. And like a lot of the difficult cases that you'll see on this channel, unfortunately, there is a lot of hair entwined with this wax, which makes it altogether more difficult to remove. So now that I've created a little bit of movement and it's loosened up, I applied olive oil quite liberally, as you can see, and going in with the suction, just getting rid of the excess oil. And then the plan now is to basically work with the suction tube just to latch onto it and eventually loosen it and drag it out. Now, the function of the olive oil when we're doing a procedure like this is not to soften the wax, because that would take far too long and, the patient would need to, give it a few hours for the oil to penetrate. But instead, the function of the oil is actually just to reduce the friction, so lubricate the canal walls so that we can drag out the wax, and also give sort of a moist surface for the suction probe to latch onto. So you can see here I'm starting with the bottom and just trying to lift it and peel it off the canal wall, and you can see some of the hairs that are entwined in there. And if you look at the slightly paler skin underneath the wax mass, you can see that thankfully there's no bleeding. I'm not lifting off any sort of skin which would cause contusion or bleeding underneath the skin. So I'm fairly confident that I can drag it out without hurting the patient. And here we see, thankfully due to the olive oil and the hook, we were able to remove it in one piece. And it's glistening due to the oil, obviously. So there you can see it. Very, very black oxidized piece. It's probably about a centimetre and a half in total. And when we look back in the ear canal, there's no damage there. It's just a few little pieces of desiccated skin. And then we have the eardrum there, which is a nice pale grey disc of skin in the background. And overall, a good outcome for the patient.